Greetings, everyone. My name is Dr. Joan Connell, and I'm your field medical officer from the North Dakota Department of Health. I want to thank you all for joining us with this presentation, Ask a Doctor COVID-19 Town Hall. I think to begin with, it would be great to meet our panelists who are joining us as we speak. So why don't we start with Dr. Foughty? Why don't you tell us a little bit about yourself?
Sure. My name is Dr. Stephanie Foughty. I am a family medicine with obstetrics physician in Devils Lake, North Dakota. I've been practicing here for about 5 years. I was born and raised in Mercer, North Dakota, did all of my medical school and training in the state. I have 2 little boys, and yeah, that's about it.
That's a lot. Thank you for sharing that. Dr. Nielsen, would you like to go next?
Sure. I'm Dr. Mark Nielsen. I'm in Grand Forks. I've been in Grand Forks for the past 9 years. I work at the residency program here. Prior to coming to Grand Forks, I was in Williston for 12 years. So I've been in practice for 21 years and very much appreciate the opportunity to be here today and to speak to all of you. Thank you.
Excellent. Thank you so much. And I will tell you guys that Dr. Nielsen went to medical school with my brother, who is an ER doc in the state. So I've heard wonderful stories about you from a wide variety of places. Well, why don't we get started with the first question? And that is, why is it good to receive the COVID-19 vaccine? And Dr. Foughty, why don't we start with you? And in your answer, I would love if you would include your obstetrics population in the category of people.
Sure, absolutely. So, in general, the COVID vaccine is extremely important. As we've seen over the past 15 months, this is a very severe virus that has affected not just our state and our country, but the entire world. And we're still learning more every day. There's really no other virus in, well, really most of our lifetimes, as you have a few people maybe that were around during the influenza epidemic in 1918, but that has taken the lives of more than 500,000 people in this country. And besides the deaths, we still don't know all the long-term effects of these viruses. Personally, we're just starting in our clinic here, we're just starting to see some of these individuals coming in with chronic headaches, chronic fatigue, muscle pain, nerve pain, all kinds of things that are not things you have really seen with any other viruses. And they're not related to age. They're not even necessarily related to disease severity. We're getting people who are not even hospitalized that were maybe fairly sick at home that are having significant long-term effects. And so, it's really easy to look at statistics and say, oh, well, I'm young and healthy. I might not die of COVID. But I know for me personally, in the decision to get vaccinated, I wasn't as concerned of the acute respiratory illness. I'm overall fairly healthy. I exercise regularly. It's the long-term effects that make me nervous. How do you go to work every day and be a doctor if you have brain fog or if you have chronic fatigue, chronic migraines? And so, from a personal standpoint, that was huge. And then when we're looking at society as a whole, we hear so often that we want to get our lives back to normal. And I would love to see that too. But in order to do that, we have to reach that herd immunity. And the only way to do that is with the vaccine. In relation to obstetric population as well, we know that COVID can present significant complications in pregnancy. There have been a few cases, even in North Dakota, where the young mothers have come and spoken out about near-death experiences that they have had, and these are again young, healthy women that have gotten very sick from this virus. People that you wouldn't necessarily suspect. We know it causes blood clots, which you're already at risk of in pregnancy. And we know that the vaccine actually is transferred through breast milk. There was a big study that came out 2 or 3 weeks ago, I think, that looked at significant antibody levels in breast milk. So if you're a breastfeeding mother, you aren't even protecting just yourself. You're potentially protecting your infant as well. So There are a ton of benefits, and there's honestly very few people out there where I would say they shouldn't get vaccinated. Very few.
Great, thank you so much. I appreciate that. Dr. Nielsen, would you like to respond to the question of why is it good for people to receive a COVID-19 vaccine?
Yes, thank you. And Dr. Foughty, I think you did an excellent job with the answer that you provided. And I think you did a really nice job talking about the long-term effects of COVID, or the potential long-term effects of COVID. I think in addition to that, talking about the here and now, what the vaccine does with regards to reducing risk for hospitalization. And, you know, the numbers in the studies that were performed are very impressive. In Grand Forks, we've had 87 people with COVID in the hospital over the past 3 months. Of those 87 people, we've had 7 deaths, none of whom were fully vaccinated. So I think it stresses the importance of getting the vaccine. The vaccine virtually eliminates severe illness. There's still a chance of hospitalization and mild illness, or being asymptomatic and carrying the virus, but it reduces the risk significantly of that severe illness. So I think for today, in preventing hospitalizations and the risk of death, and for preventing the long-term complications associated with COVID, as Dr. Foughty alluded to, I think it's tremendously important that people get vaccinated.
Great, thank you so much, Dr. Nielsen. Now I would like to take this opportunity to have Dr. Oksa, who has just joined us, introduce herself and just tell us a little bit about yourself, anything you want to share, and then you can just jump in and answer this first question of why you think it's a good idea for people in general to receive the COVID-19 vaccine. Dr. Oksa, can you unmute your mic, please?
There we go. Yep. So sorry, I was a little late. I had a little trouble hooking up. But so Amy Oksa, I'm a pediatrician at Sanford Health in Dickinson. So I'm on the southwestern corner here, and I am also a public health officer for the Southwest District Health Unit. So I've got a little bit of experience, a lot of experience in pediatrics and some in public health. So I'll come at it from a children's point of view also. So why is it important for people in general to get the COVID vaccine? And I didn't hear all the responses. I heard Dr. Nielsen's, but I think, gosh, where do you start, right? I think you have to look at it both from an individual and a community level. I'll start with the community level. It's important for everyone to get vaccinated, to do our part in developing and attaining herd immunity, and trying to get things back to normal. Socialization and I mean, just and we think about vaccines to help prevent physical disease and stuff, but it just has so many. I think getting people vaccinated has so many other implications as far as emotional and social and everything, economic, everything. On a more individual level, get vaccinated, obviously, to prevent illness in ourselves, but this COVID is a different kind of illness where so many people don't have symptoms, and then they are transmitting the virus to other people. So I think getting the vaccine is important to keep one another, ourselves healthy, but also to prevent us from prevent people from unknowingly transmitting the virus to people that may be at higher risk. I mean, I think there are just so many reasons to get the vaccine. So I won't go on and on. So, yeah.
No, I love that you're expounding on all of those, and especially how they affect you in your practice. And I guess as a pediatrician as well, I agree with everything you guys have said, and I will just add, in my role as pediatrician for Children's Regional Asthma Clinic, I am unfortunately seeing a couple long haulers I'm seeing that primarily in very competitive athletes who can't get back to where they were from their infections that they experienced in the fall. So to me, that's really scary. And I wonder, you know, when we read the literature as physicians, we see people who even had a relatively asymptomatic infection who end up getting chest x-rays or chest CT imaging done for a different reason down the line, a significant amount of changes, adverse changes on those x-rays and CTs. And I wonder what I would see in my patients who are struggling to get back to normal, who are the epitome of health. So I think that's a big motivator for me as well with my patient population. Can you tell me why each of you decided to get vaccinated? And Dr. Oksa, we'll start with you and then go in reverse.
All right. Well, I was one of the first people, I think, in Dickinson to get vaccinated shortly before Christmas. And I mean, again, there are many reasons, some of what I just, you know, things that I just talked about, but I was unfortunate enough to have COVID in the fall. Unfortunate that I had a close contact that ended up getting it and was pretty much asymptomatic, and I ended up getting it, and I did not get too sick, but just I mean, had to miss work for a week and a half. It interfered with so many things, just life, you know, just in life. And even though I didn't get too sick, the anxiety that it caused, you know, the anxiety of, oh gosh, what's tomorrow going to be like? Today was okay, I have mild symptoms, but what's tomorrow going to be like? What's the next day going to be like? What's the next day after that going to be like? When am I going to get real sick? Am I going to be hospitalized? And I'm healthy, but I have age that is not on my side, and I never did get too sick. But you know what? I had fatigue afterwards for a couple months, and one of my family members that was older and had significant risk factors got really ill. So to know that, or to the unknown of, hey, how much of this natural immunity will I retain? Will this be gone in 3 months? Will it be gone in 6 months? I said, I don't want to have to take that chance. I want to get the vaccine so this doesn't happen again. So I don't, you know, possibly get infected again, and who knows what it's going to be like. It was already stressful enough for myself, my family, my coworkers, everything, you know, and the thought too, as a pediatrician, you know, gosh, I wasn't symptomatic when I tested positive. Did I give this, you know, the fear that I've given it to one of my coworkers, the fear that I've given it to one of my patients, even though I was very good at social distancing and wearing masks and stuff. So I guess the main reason that I initially got it was I don't want to have COVID again. I tell people, I said, I fear the virus a whole heck of a lot more than I fear the vaccine. And I know some people do fear the vaccine and some people do get side effects, but I mean, that's the primary reason that I got it, and also to one last thing, and then I'll be quiet. But to be a role model, you know, I get the vaccine, and I even have a little thing. I don't know if you guys can see, but a little thing that on my ID that said I got the COVID vaccine. I think if people look at me and they respect me and say, well, Dr. Oksa got the vaccine, I think I'll get it too, you know, or at least it will open up dialogue. So I want to be the role model because I think everyone that qualifies to get it should get it. So I'll end there. Yeah.
Great.
Yeah.
Additional comments?
Yeah, so from my perspective, I think there's 3 kind of groups of people, if you will, for why I got vaccinated. You know, first is for my patients, and as Dr. Oksa referred to, I felt that it was important to that I role model that it's safe to get the vaccine. In the practice that I'm in, we have 39 physicians in the building and 39 physicians were vaccinated. So it's a large group of people that work together that felt that it was important that they get the vaccine for various reasons. But as a physician, I didn't want to carry the virus asymptomatically and not know that I had the infection and potentially infect one of my patients that I provide care for and make them more sick. Secondly, I got the vaccine for family, friends of my work colleagues. You know, there's, especially towards the start of the pandemic, the exposure that we had to our family, my parents, grandparents, did not feel safe being around them. Friends in town wouldn't congregate with them because of the risk of me getting the virus from them or vice versa. And then of course the work colleagues as well. As I suggested, everybody here is vaccinated, so that risk is really minimal. And lastly, I got the vaccine for myself, both psychologically and medically. Psychologically, it provides me some freedom, some stress relief, in that I don't have to worry so much about getting severe illness. I know that I could still get very minor illness or carry the virus asymptomatically, but the chances of me getting sick and being hospitalized and becoming very ill are very, very low. And also psychologically, it does allow me then to get outside the home, congregate with other people that have been vaccinated. It allows me to be outside without wearing a mask, and there's some liberties through protection with the vaccine that you have that you wouldn't have if you didn't get the vaccine. So I think for all those reasons, it was important for me to get vaccinated.
Excellent. Dr. Foughty, do you have anything to add to that?
No, the only thing I was going to add, I said I can tell I trained under Dr. Nielsen because I actually was thinking the exact same group of people. But for me, the other thing, I had a baby niece and nephew born in the fall that I really wasn't comfortable seeing until I was vaccinated. And so, you know, for me, that was a huge perk of being vaccinated is now, you know, I'm still going to avoid them if I'm not feeling 100% well or if I have any concerns, but I feel more comfortable being able to be around them and taking appropriate precautions than I did prior to being vaccinated.
Yeah, and I totally understand. I guess the one group of people that I would add to that is my kids. I have two teens who are both athletes, and the thought of me giving the virus to anybody, my patients, but my kids, and ruining a second soccer season for them would be more than I could bear. So my older daughter is now vaccinated. I'm just chomping at the bit for kids 12 to 15 to get vaccinated, because then my son will be covered. And Amanda, I'm just going to address your question now. When do we anticipate children under 12 to be able to get vaccinated? And, you know, as they started doing research in hospital workers, actually, and long-term care workers on the vaccine, so those were all adults, and then that population gradually expanded as they were proving safety as well as efficacy. So we are on the verge of emergency use authorization for 12 to 15-year-olds. We're hoping that's going to happen sometime in the next week or so. Stay tuned and be poised to get your 12 to 15-year-olds vaccinated. And then the studies are ongoing right now for the populations down to 6 months. So as soon as we get the thousands of patients we need to prove safety and to prove efficacy, that's when the vaccine will be available, and not before. And that's the standard that's been that holds for all vaccines, including this one so far.
You know, I think that's a super comment that carries through to adults who don't want to get vaccinated. I think, you know, the vaccines are still under emergency use authorization, but the studies that were done with these vaccines are larger than any other vaccine in the history of vaccines. And the CDC, or the FDA, I'm sorry, is being very, very diligent about not releasing the vaccine until they're confident that the vaccines are safe. So, you know, next week, presumably when 12 to 15-year-olds are going to be able to be vaccinated, I'll be very comfortable in recommending that those people get vaccinated, but I think it's going to take some time for those younger than age 12 before that's approved, because they want to they want due diligence to be sure that it is safe.
Yeah, this is Dr. Oksa. Another comment on that. I was reading something this morning. I think it's from. I'm not going to quote where it was from, but I believe they're saying maybe midwinter, you know, early 2022. I think maybe for the 6 month to through age 11. And I know Pfizer and Moderna both have studies going on for different doses for different ages and such, looking at that. But yeah, I think I would, from what I read, I'd be surprised if it was before like January. Yeah, but that's still really good timing. That's still excellent. Yeah.
Yeah, and I just want to illustrate this point. The soccer team rode on the bus to go play their game yesterday. And it was this giant relief for me to know that my 17-year-old is vaccinated. And it doesn't matter what happens, she's going to be all right in that situation. And then I'll also add, because I think it's interesting, and we'll get to the side effect question later, but since we're on this topic, one of the girls who was also on the bus had received her second vaccine the day prior. And she did experience some chills on the bus, but I'll tell you, she played her position wonderfully, and it didn't slow her down at one iota. So, so we'll talk about side effects, but I want you to remember that story when we get to that question. I would like to ask another question of you guys and get your opinions. So now that the FDA and the CDC have lifted the pause on the Johnson & Johnson vaccine, are you once again recommending that to your patients, or what are your recommendations?
Yeah, I'll respond to that. Absolutely, yes. You know, when the pause came out, again, it shows the diligence of the FDA to be sure that the vaccine was safe and that it wasn't something that was secondary to the vaccine. The most catastrophic of those potential adverse reactions that were discussed is the venous sinus thrombosis, where you develop a blood clot in your head. And the prevalence of that thrombosis was less in those that were vaccinated than the general population. And so I felt from the beginning that it wasn't going to be determined to be something that was secondary to the Johnson & Johnson vaccine. I was impressed that the FDA put a hold on it and did the due diligence to prove that it was safe. And that being said, I'm very confident in telling my patients to get the vaccine.
And I would just second that. I mean, I take care of a lot of women of childbearing age. And so I frequently get asked about that because that's a big chunk of who I see. And as Dr. Nielsen said, you know, the risk is no higher with the vaccine than it is living your day-to-day life. You know, I remember shortly before the Pfizer vaccine was released, Dr. Paul Offit, who's kind of the god of vaccines, had said, you know, that he anticipated that we would have something like this with one of the vaccines, because there are people who are going to have medical events, whether that be stroke, heart attack, you know, a venous thrombosis that happen after the vaccination. And we just have to remember, as clinicians and as people who are educating the population, that we have to make sure that those are occurring in the vaccinated group at the same or a lower rate than it occurs in a non-vaccinated group. Because if that's the case, then that means it's just an unfortunate coincidence.
Yeah, and I'd like to do a shout out to Dr. Paul Offit also, and just tell anyone who's on this, if they ever have any vaccine questions in general, Google Dr. Paul Offit of Philadelphia, because there's all kinds of good information out there that he puts out with vaccinations. But in regard to the Johnson & Johnson, of course, as a pediatrician, I don't have many patients that are eligible to get it, but the ones that are, I wholeheartedly support that administration of that vaccine.
Great. Thank you guys. And I'm going to add from the chat. It states, at our local public health unit, we are still offering and recommending the Johnson & Johnson vaccine. We've had people still interested in getting it rather than Moderna and Pfizer. And you know, I one shot and done, so I totally understand that. And I'm glad people can see the science. And which you guys explained so well, so thank you. Another question from the Q&A. What is the plan to educate and persuade all the North Dakota deniers of COVID-19 vaccine about the need for the vaccine? Dr. Foughty, let's start with you.
Yeah, that's actually a tough one. I mean, I guess I look at it, I take it on as a case-by-case basis. I've gotten to where, you know, if I walk into my children's daycare or we're at a school event or whatever, and I hear people talking about it, especially if it seems more just misinformation, I just think it's kind of my job as a physician to educate. And same thing in when I'm seeing a patient, you know, I ask, have you had a COVID vaccine? Or, oh, I see on your medical record that you haven't had a COVID vaccine. Are you planning to get one? I think a lot of this is going to come down to individual education. And of course, the Department of Health has had a huge campaign to get people vaccinated. But I think it really is going to be two things. It's going to be the campaign is going to help some. I think it's going to be one-on-one information from physicians, but I also think it's going to be, we're going to see it as more and more people get vaccinated, that I think that will in turn get more people vaccinated. We've already seen that. I think it was prior to the vaccines being started. I think even in North Dakota, it was only like 49% of people were planning to get vaccinated. And we have seen that percentage steadily increase. Unfortunately, our numbers are not yet, even with people who plan to get vaccinated, where we would reach herd immunity. But I'm cautiously optimistic that as time goes on and we have the numbers and the data that people want to feel it safe, that we will get that number that we need.
I think that's a great answer, Steph. And I think the large push for those that want to be vaccinated has been done, is that vaccine curve has really started to flatten, although there still are a lot of opportunities to get the vaccine. I know they did it at the Empire Theater in Grand Forks last night, and they're doing it at Walmart next week. So it's more creative than it was at the start, and it's bringing the vaccine to the people, and I think that that'll help. I agree with Dr. Foughty 100%. That the people that have a reluctance to get the vaccine, I think if you're attending this this town hall, good for you. Good for you for exploring it. If you haven't been vaccinated, it's good for you to get yourself educated. And you should know that all of us didn't discuss anything prior to the meeting, so we're certainly each representing our own opinions, and maybe by happenstance, but probably as with most medical providers, we really support the vaccine. But I think also moving forward, I think when the FDA removes the drug from emergency use authorization, likely in August, that'll help. A lot of employers, when that happens, will probably require it. But that's a couple months away, and the sooner we can get more people vaccinated, the better we're all going to be.
Yeah, and I agree with Dr. Nielsen. One thing that we need to, I think, even though the vaccination curve has kind of flattened, I think we need to continue having the vaccine available multiple times a week in different venues and stuff. You know, and I'm all for, and I don't know if we've done this much in North Dakota, but I'm all for, you know, rewarding people that have gotten the vaccine. You know, I know some companies are rewarding them, you know, with a monetary, you know, reward, but doing things like that, these statewide campaigns, talks like we're doing today. But I think on a more individual level, as a physician, you know, Dr. Connell and any of us that give a lot of vaccines on a daily basis, you know, the infant and childhood vaccines, and we have seen over the last several years a number of families that are very reluctant to get just our routine vaccines, we've become somewhat adept at listening. Listening to people as far as what are the reasons that you're reluctant? Because people have different reasons. Sometimes we think we know, but maybe that's not the reason that this person has reluctance or that person has reluctance. So being available on an individual basis and listening to what their concerns are, and then helping to address them might make them more comfortable.
Yeah, I agree. And when we look at what is working in other places, I agree totally with you, Dr. Oksa. That relationship of the patient with physician is really, really important. So if you have questions, talk to your doctor. Your doctor wants to talk to you about this, and your doctor very likely wants you to get vaccinated. All right, so let's move on to the question, are the vaccines effective against the emerging COVID-19 variants?
All right, I can start with this one. So right now they are. So without getting too sciencey, basically the vaccines through different ways, Pfizer and Moderna through mRNA and Johnson & Johnson through a viral vector, are targeting something called a spike protein. This is basically a little protein on the outside of the COVID-19 virus that allows it to attach to cells and whatnot. But the vaccines that we have basically essentially create this protein, and that's what our body builds antibodies against. So far, we've been fortunate biologically that all of the known variants have the same spike protein. So what that means is as long as they keep having that protein on the outside of the COVID virus, and as long as that protein doesn't change, then the vaccine will continue to be effective against the different variants. Now, there's going to be slight percentage differences against different variants, just based on how fast they replicate and how contagious they are and different things like that. But overall, as long as that spike protein stays the same, we will have some effectiveness of our current vaccines against the emerging variants we're seeing now.
Anybody want to?
That was a pretty impressive answer. Good for you. Well done.
Thank you.
So I guess I agree with what Dr. Foughty has said. Is the vaccine as effective against the variants as it is against the original virus or the novel coronavirus? And the answer is primarily yes. Is there some diminished effectiveness? Yes, not enough that it really makes a difference. It's going to largely protect you, as Dr. Foughty alluded to.
Super. Thank you, guys. Why don't we talk about side effects you've noticed from, or you are aware of from the vaccine, and then let's particularly address that, and then we'll go on to something else. Sorry.
Well, I've not had any patients that have had any severe reactions to the medication where that you get the severe allergy. And really that's the only contraindication to getting the vaccine is if you have an allergy to the component of the vaccine itself. If you have an egg allergy, it's not contraindicated, etc. So that said, out of all the patients that I've had get the vaccine, which is hundreds, the longest person I saw that had symptoms was a lady that had fatigue for a week. Otherwise, everybody else has been 24 to 48 hours or nothing. And the majority of patients, at least in my experience, don't have any sort of side effects from the vaccine at all. Those that get symptoms tend to be fatigue, chills, headaches, and body aches. In my experience, if you previously had the COVID virus and get the vaccine, those side effects may be a bit more pronounced, but nothing that is stopping them from doing what they want to do. Generally, they still go to work and are able to get through things okay.
Just a comment on the pediatric population, the 16 to 18-year-olds right now that can get the vaccine, and it's rather anecdotal, and the numbers aren't high that I've seen, but the kids seem to do pretty well so far as I think fewer side effects than even some of my coworkers in their 20s and 30s. Yeah, so that's kind of what I've seen with that so far.
That's been my experience as well, with my patients, and also with my daughter. It didn't slow her down for a minute. I will tell you personally, the first vaccination, I had a really sore arm, and my arm probably was more sore than it has been with any of my influenza vaccinations. And then going into the second vaccination, I remembered what I always tell my patients, and that's to move the arm that gets vaccinated for about an hour after vaccination. And my arm, it didn't bother me at all the second time around. So I think that's pretty effective. I mentioned the athlete who was vaccinated the day previously prior to her game and had some chills, but played wonderfully during the game. So that's been the big experience of a side effect in the pediatric population. Dr. Oksa, can I just ask, when you were vaccinated, having been a COVID survivor, do you feel like your reaction was more significant than others who had not had COVID?
Not at all. My reaction was very similar to yours. A little bit of soreness after the first dose, and maybe a little bit of fatigue. But I tell people, who knows what fatigue? It could have been the time I was on call for the previous 3 nights. Who knows? But and it was the holidays, so who knows? But then the second one, I think I had a little bit of fatigue, just maybe really a little bit. Maybe the arm was just a little sore, more sore, I should say. But really no more. So you hear people that say, oh, if you've had COVID, your reactions are going to be a whole lot more. I just think similar to how the virus affects people in all different ways. I think the vaccine does too, as far as minimal side effects. Ooh, I just went off here. I guess I haven't moved around, and I'm in Bowman right now. I haven't moved around in the office. When I get done talking, I'll turn the light back on. But so anyway, no, I had very minimal side effects.
Do you guys want to comment?
No, I would say I would agree with what both other previous physicians said. Is, I mean, I think side effects for me, I had a sore arm the first time. The second time, really not much. I had a couple coworkers that had had COVID previously that had a pretty significant response, pretty good body aches, headache, usually starting about 8 to 12 hours after the vaccine and lasting about 12 hours. But all of them that had that with their first dose did go on to get the second dose. So it was not severe enough that it impacted their decision to get a second dose at all.
Super. And Dr. Foughty, will you just please also comment with your work with pregnant women and women of reproductive age, the concerns that are being raised on Facebook about effects on fertility and pregnancy by the vaccine?
Yeah. So I actually read the claim quite carefully, because that's a huge percentage of my population. And we, in Devil's Lake, a lot of our healthcare workers in the ER, on the hospital floor, in the clinic also fall into reproductive age. So they're at higher risk. So I wanted to make sure I was giving correct information. And again, I'm not going to get very sciencey, but basically the pathway that the individual who made this claim suggested that it caused infertility actually is not biologically possible. It's not a thing. And so, I've had patients who have gotten pregnant since being vaccinated. There has been no evidence, and you think of how many people have been vaccinated since December or January, and there is no evidence that there's any effect on fertility. There's no evidence that it causes any issues with pregnancy. And so really, I am encouraging my patients, especially those who work in high risk environments where they're around around people to get vaccinated. Generally, my rule of thumb is if you're really nervous about it and you are pregnant, talk to your prenatal care provider. A lot of times if I have a patient that's really nervous, I'll say, okay, let's hold off till second trimester. Like, let's get past the stressful part of pregnancy and let's do it in the second trimester. But I really do feel that in this case, the benefits outweigh the risks. As I mentioned before, we know there's risks of getting COVID when you're pregnant. There's respiratory risks, there's blood clot risks. It is not a risk-free virus. I mean, to me, getting COVID when you're pregnant is much more risky than getting influenza or other common viruses. And so there has been, again, no evidence that there is any reason that you should be concerned. If you are pregnant, you're planning to get pregnant, and you should still get vaccinated.
Dr. Nielsen, do you have anything to add to that?
No, I think it's pretty well been covered. I think benefits far outweigh any risks of an adverse reaction.
And I really like and appreciate the risks of the disease versus the one person's concern about risk of the vaccine that was raised, because we have lots of documentation about the known risks of the disease, and that's very concerning to me. Renee Jean from the Williston Herald is asking, what's the percentage of doctors supporting the COVID-19 vaccine? I see a lot of comments online claiming that a lot of physicians do not support getting it.
So
all right, I'll go first. I know in the Sanford, Bismarck region, physicians are by far the highest takers of the vaccine, with well over 90+%. I don't know if we're at 100, but we're pretty darn close. So it's very high, and I believe at our local Dickinson CHI hospital, the number is similar.
Yeah, so there was actually a study done on this last December and January across the United States, and the number at that time was 82% of physicians recommended that their patients be vaccinated. I'll echo Dr. Oksa's statement again. You know, we have 39 physicians in this building who received the vaccine. And I know we have 39 physicians that are recommending the vaccine to their patients. So I think at the primary care level, it's very, very close to 100% of physicians that are saying that we should vaccinate our patients.
Anything to add to that, Dr. Foughty?
No, I would just agree. I think there was looking at something I read, oh gosh, maybe a week ago, and it was right around 90%, I believe, and they were looking at regional. I can't remember exactly what health systems on that, but they were talking regionally. They were looking at the breakdown, and it was around 90% of physicians then talked about how the numbers kind of dropped as you got to different healthcare levels. But I would say the same as here in Devils Lake. We are very close to 100%, if not 100% vaccinated.
Super. Thank you guys. So we've touched on this a little bit, is particularly you, Dr. Oksa, but let's revisit because we've got something in the chat about why do I need to be vaccinated if I had COVID? How long should I wait after having COVID to get the vaccine? So let's revisit that. Dr. Oksa, do you want to start?
Oh, sure, I'll start. So I'll answer the first. Repeat the question one more time, Joan. I got the second part. What was the first part again?
Sure. It says, oh, it was taken off. It said something about why should I get vaccinated if I've already had the disease, and then how long should it be from the disease?
So I think why should get vaccinated, because we do not know how long the natural immunity lasts. And also I think we talked about the variants. I think just in general, improving our immunity and hopefully lengthening our immunity to the virus. How long should one wait? Now, I think that's dependent. There's lots of different answers that I've seen on that. I think technically, once a person is out of quarantine and physically healthy enough to get the vaccine, I believe they qualify to get it. I know there have been sites and physicians that have recommended waiting, at least this was initial recommendation, waiting 90 days. Yeah, I think that was just a general guideline. My interpretation of that was a general guideline for to say, hey, you know, you're not at high risk right now because you have some natural immunity. If there's a shortage of vaccine, you know, let other people have it that don't have the natural immunity. But I believe you can get it as soon as you're out of quarantine and feeling well enough to get it.
Yep, I think the only exception to that would be some of the monoclonal antibody therapies. If you're somebody who's sick enough where you're not hospital sick, but you did receive the outpatient treatment, they do recommend 90 days from the day of receiving your antibodies. But otherwise, yeah, it's basically whenever after you're out of quarantine and you feel good enough, go get your vaccine.
All right, that's super. I don't want to forget about the question on the top here. The anonymous has been very patient. So it states, I am a long hauler. Have you been seeing spontaneous hematoma? I am fully vaccinated.
So I'll respond to that. So first of all, to you that is a long hauler, please know that we're with you and support you and understand what you're going through. And also good for you for getting vaccinated. Very, very important. With regards to spontaneous hematoma, I have just a few patients, thankfully, that are long haulers. In my practice, I haven't had anybody with a history of spontaneous hematoma.
Anybody have to add to that?
I have 2 long hauler patients, unfortunately only 2, and I haven't seen this in either of them. And I have to say I haven't specifically researched a spontaneous hematoma, so I can't really comment if that's something that's popping up elsewhere.
Okay. We know that COVID does affect the coagulation pathways, so the clotting pathways. So, you know, I think it would be something very reasonable to explore with your doctor. Kylie asks, Tucker Carlson has made claims on Fox News about COVID-19 vaccine causing death. Can any of you comment on the deaths reported to VAERS and how to know if the vaccine caused those deaths?
I can talk a little bit about this. So with VAERS, they're going to report, so the idea is that you report any side effects. So any death that occurs, I believe it's within 30 days of vaccination, regardless of the cause of death, is reported or is able to be reported. And then, and so this can be, I mean, this can be a car accident. It could be if somebody has a heart attack. And so if you go and you Google on the CDC and you look up vaccine deaths and COVID, that's the number that pops up, is the number of deaths that have been reported within 30 days of the COVID vaccine. That is not a number of deaths that is caused by the COVID vaccine. The FDA then goes through and looks at these deaths and says, okay, how many, since I said stroke, we'll say stroke. How many strokes were there in this number of patients? And again, goes back to what I mentioned earlier of, is this a higher number than we would expect to see that occurs in nature? So if you have 3 people who are in their 60s and 70s that died of a stroke within 30 days of getting their COVID vaccine, that would not be attributable to the vaccine. You know, we have seen, as Dr. Nielsen had mentioned earlier, how diligent the FDA is being with these vaccines, you know, pausing J&J when there was this concern about a blood clot. And so knowing that, the idea that they're ignoring vaccine deaths is, it just doesn't make sense. It's not something that has been anywhere in any of the scientific literature. It's not anything that, as a physician, I'm concerned about. It's somebody, I think, misinterpreting the way the data is being reported.
Doctors Nielsen or Oksa, do you have anything to add to that?
I think
No,
that was a summary.
I think that was very, very well done still.
Well stated. All right, let's go with Jeremy Turley from Orem News Service. How confident are each of you that North Dakota and the nation will actually reach herd immunity through vaccination? The rate of vaccination in North Dakota has begun to plateau in recent weeks.
I guess I'll take that first, I'm hopeful. I have some level of confidence, but I have, I guess, more level of hope.
I think that that's well stated. That's a $1 million question. I think that if we could get 70% of our population that actually got vaccinated, that we could achieve herd immunity. That's a big if, and that's where it turns into hope. I hope that 70% of our population chooses to vaccinate. And if they don't, I think the potential of COVID being more a long-term virus is very real.
One other comment I have on this too is I think it's really going to depend too on the uptake in our adolescents initially, and I'm really unsure about that. I think I sense that's going to the adolescent uptake is going to mirror the adult, but probably it may not even be as high, because I think if parents get it, their kids will get it. If parents haven't gotten it, then a lot of times their children aren't going to get it. And then it also, of course, depends upon when the 6-month to the 11-year patient population can be eligible. And especially, they're talking that some of these variants, they seem to be a little bit more transmissible in the pediatric population than the novel COVID virus was. So if that happens and more variants and there's more transmissibility by kids, then I think it's really going to come down to the pediatric vaccination rate.
That's my concern as well. What do you guys think about that?
I have the same concerns. I think that when it comes to children and immunizations in general, I can't remember, maybe it was you, Dr. Connell, that mentioned this earlier. We've been seeing an increase in vaccine hesitancy, even with routine vaccines that have been studied for years and years. I mean, when we're looking at medical science, there's nothing that's studied as well as vaccines, and yet we see hesitancy. And so I am hopeful, but I'm also nervous as we start seeing these vaccines available to our children. I guess my hope is that science prevails and some of the misinformation that's out there is overridden by science, and ultimately that parents, want to see their kids get back to normal and want to see our lives go back to as close to normal as we can. I don't think we're ever going to get quite back to where we were prior to March of 2020. But I think, the biggest disadvantage we have is with all the great things that technology has allowed us to do over the past 15 months, it has also given a whole new avenue for loads of misinformation.
Anything to add to that, Dr. Nielsen?
No, I don't have anything to add.
All right. So Anonymous at 321 says, not necessarily vaccine related, but I am struggling to make the decision to vaccinate because I've been a close contact multiple times, had all negative COVID tests, and have been negative for antibodies all year, consistent plasma platelet donor. How is this possible? Could you say my risk perception has dwindled to a level where the vaccine is now giving me pause? Or guess you.
Well, that's a good question, and Anonymous, you're very fortunate not to have contracted the COVID vaccine or the COVID virus, and good for you. I'd ask you still to consider getting the vaccine, not only to potentially protect yourself, but to protect those that you're around. you made, a number of COVID infections are asymptomatic and you can transmit the virus to other people. By getting the vaccine, it's going to reduce the risk likely that you'll transmit that virus to other people.
Okay, great. I think we have time for one last question. And there was a question about concern about the vaccine changing our own DNA. Do you guys have any concerns about that, and why or why not?
So I can answer this since I guess I've been doing the sciencey stuff today. So no, the vaccine, especially I think this concern mostly comes with the Moderna and the Pfizer because it has RNA in the name. It is an mRNA virus. This does not go near your DNA. Basically, if you think of the vaccine like an instruction manual, the vaccine carries the instruction manual in a little package, which is a fat, basically kind of like a fat cell, or a fat molecule, which is why it has to be kept at such interesting temperatures, and it brings it into the cell. It then tells the machines of the cell to make, again, this spike protein and release it into your body. The spike protein is what your body builds the antibodies to, as I mentioned earlier. Once that's done, this disappears. It is broken down by the cell and it is gone. And those antibodies are all that is left. This doesn't go in the nucleus, which is where your DNA is. It simply is out kind of in the working machinery part of the cell. So no, I have zero concerns that it has affected my DNA. I kind of kept hoping I'd get some superhero powers or something, but that has not happened.
All right, I think that was a great response to the question. Does anybody have conflicting feelings about Dr. Foughty's response? Okay, and then I just have to, we have to end because it's 3:29, but this last question very much intrigues me, and I have heard that there's a lot of questions about this. So is there any advantage to one getting an antibody blood test performed? What does that tell you?
So to get the antibody test performed, the answer is no. I do not recommend that people get the antibody test. The recommendation is to be vaccinated whether or not you've had COVID previously. It's an unnecessary test for you. There's costs associated with that test that insurances aren't paying for in the majority of circumstances. So it's unnecessary cost to you. And regardless of the result, positive or negative, vaccination is still recommended.
I would certainly agree with that.
And that's how I feel too. And I feel in some instances, this truly is being used as a moneymaker for companies who are setting up shop to make a quick buck. So don't be fooled by that. All right, so I will say the one instance though is in certain populations who are hospitalized with, walks like a COVID, talks like COVID, quacks like COVID, but you're getting a negative COVID test. The CDC has in the past at least recommended doing antibody testing in addition to testing antigen testing of other body fluids to try and confirm diagnosis once the patient has been sick for a certain time. So there is possibly a role in diagnostics in that very small subset of the population. I would like to keep visiting. You guys are just wonderful physicians and what great stewards for your community. And I'm so awestruck and appreciative for all you have shared and how lucky your patients must be to have you as physicians. So thank you so much for taking some of that time and sharing your knowledge and expertise and wisdom from your walk with your patients and your families and yourself, Dr. Oksa, with COVID. Thank you all for joining us. To the person who says, rather than arguing, is there a good source? I did find a nice Paul Offit video that I shared with Paul Teeple, who's working with us today. And so, Paul, will you make sure you respond to Anonymous 303 and share that link that I sent to you, okay? To the rest of you, thank you. Stay safe, stay healthy, and get vaccinated. Take care, everybody.